Hello and welcome. I'm Dr. Alan Lawrence. Today we're going to talk about contraception, pregnancy prevention, program number 3, birth control methods, prescription contraceptives. This program is a presentation of Health Education Associates of Palm Springs, California. What is contraception? Contraception relates to the prevention of conception and hence pregnancy. It is also known as birth control, and in some places, family planning. What are contraceptives? Contraceptives are any process, device, or method that prevents or interrupts conception and/or implantation of the fertilized egg within the uterus. Why use contraception? Contraception is used to prevent unwanted pregnancies, to control when pregnancies occur, and to prevent the need for abortion. Contraception can also help a couple maintain control over their life and their overall well-being. Types of contraceptive. There are many contraceptive methods currently being used. The most commonly used methods are 1. Abstinence, 2. Natural contraception, withdrawal, basal body temperature, cervical mucus evaluation, and following the signs and symptoms associated with ovulation. Barrier methods. These are physical methods, condoms, diaphragm, cervical caps, chemical methods, spermicidal gels, creams, foams, and suppository inserts into the vagina, and then the combination of physical and chemical methods used together. Hormonal steroidal methods. These are oral contraceptive, often called birth control pills. There are many different types of birth control pills available. We will not go into those in this presentation. Non-oral contraception, Depo-Provera injectable, and Norplant inserts, which are inserted under the skin of the upper arm or body. Additional methods of contraception are emergency contraception, the so-called next day or morning after pill, which is a potent hormone that changes the ability of the sperm and egg to survive before conception and the ability of a fertilized egg to be able to implant. Intrauterine device is a device that inserts in the uterus and blocks the ability of a fertilized egg to implant. Surgical permanent sterilization. In women, there are tubal ligations and hysterectomies. In men, vasectomy or removal of the testicles. And last, not often considered to be a contraception method, but often used as a final resort for contraception, is abortion. Ovulation and impregnation. This is a summary of what had previously been learned in slideshow number 1, Contraception, Pregnancy Prevention, the Basics of Birth Control. Here we see ovulation, the egg transiting the fallopian tube, fertilization, the egg entering into the uterus, and if fertilization has occurred, this egg will implant, then burrow into the endometrium. Implantation is often referred to as impregnation. In this slide, we see the menstrual cycle from a slightly different perspective. Here we see that of the ovary with its various physiologic and anatomic changes. Below this box, we see the lining of the uterus, and we see how the combination of the changes within the ovary and the changes within the lining of the uterus are synchronized so that they can work effectively to allow implantation to finally occur once fertilization has occurred. When we talk about birth control, we will discuss how this cycle is interfered with so that the production of FSH, LH, estrogen, ovulation, and hence fertilization are interrupted and pregnancy is prevented. Oral contraceptives, birth control pills. The pill consists of synthetic hormones, estrogen and progesterone, that act by preventing ovulation. The hormones in the birth control pills also change the lining of the uterus so that it is incapable of allowing implantation. It also changes the cervical mucus so that the mucus becomes hostile to sperm cells, blocking them and not allowing them to enter into the uterus, nor to be chemically capable of fertilizing an egg cell. Emergency contraception, abbreviated often as EC. On occasion, women may have unprotected intercourse. A condom may break or come off. A diaphragm or cervical cap may break its seal and allow sperm over its edge. Emergency contraception can be used in these circumstances to protect the woman from an increased risk of becoming pregnant. Emergency contraception, sometimes referred to as the morning after or next day pill, may be necessary to protect against pregnancy when plans go wrong. The high dose of female hormones, given in 2 dosages over 2 days, or even with the use of an IUD for 5 days, can be used within the first 72 hours to prevent implantation. Depo-progesterone. Depo-progesterone is an injectable synthetic progesterone. It is a long-acting method of contraception. It is given as an injection in the deep muscle tissue of the arm or hip as a single injection which will last approximately 3 months. As with all other methods, there can be side effects which can include some or all of the following: irregular menstrual periods, depression, swelling, redness, and or pain at the site of injection. Unlike other methods which are immediately reversible, the effects of depo-progesterone can last until the injection is entirely used up, 3 or more months. The contents of the injection cannot be removed or undone once given. Norplant inserts. Norplant is between 2 to 6 small progesterone hormonal capsules that are surgically implanted under the skin, usually in the right or left arm. The contraceptive action lasts for approximately 5 years, and hence no other contraception is needed during that period. The most common side effect is irregular menstrual periods, and unlike depo-progesterone, if so desired, the implants can be removed at any time. Norplant has been shown to be between 99 and 99.95% effective in preventing pregnancy. It is considered to be one of the most reliable forms of birth control. It has 3 main problems, however. 1, it requires surgical implantation. 2, not every physician or clinic inserts Norplant. And 3, it's expensive. Intrauterine devices. IUDs, or intrauterine devices, are plastic or metal devices that can be inserted through the cervix up into the uterus. The IUD acts by preventing the fertilized egg from implanting within the lining of the uterus. They are very effective and only slightly less than birth control pills. Depending on the type of IUD that is going to be used, IUDs can stay in place within the uterus from 1 to 10 years. They can be removed at any time the woman desires and are generally considered to be low risk. Permanent surgical sterilization, tubal ligations. Tubal ligation is a surgical procedure which can be performed immediately after childbirth or at any time during the menstrual cycle when the woman is not pregnant. The 2 fallopian tubes are tied, then cut, interrupting the path of the sperm and the egg so that they cannot meet and fertilization cannot take place. Tubal ligation is generally considered to be a permanent method of sterilization, but on occasion it can be reversed. It is not suggested that if future pregnancies are still under consideration, tubal ligation should not be done. Permanent surgical sterilization, hysterectomy. If the uterus, with or without the tubes and ovaries, is removed, then pregnancy cannot occur. Rarely at this point in time is a hysterectomy done just for contraception. Generally, a hysterectomy requires one or more of other reasons or problems to suggest a hysterectomy as an appropriate treatment. Hysterectomy is a major surgical procedure and should not be used, for it is a high-risk situation, and it should not be used in place of other lower-risk contraceptive methods, unless there is a major health risk which is also involved. Permanent sterilization, vasectomy. This procedure is for the man who wants no more children and is absolutely sure of this. The tubes, in men called the vas deferens, sperm from the testes to the outside world during ejaculation. During the vasectomy procedure, these tubes are cut, tied, and hence no longer allow sperm to flow out of the male. Pregnancy is prevented because no sperm is available to cause pregnancy. In certain situations, this procedure can be reversed, but generally it should be considered to be a permanent solution. Abortion. If and when pregnancy occurs, whether because the woman was not protected or because of a failure of a contraceptive method, the pregnancy can be terminated. In order to do this, a surgical procedure called a dilatation and curettage, or D&C, is used. The procedure includes the dilation and then penetration of the cervix with instruments to suction out the early pregnancy. While this procedure is done relatively frequently, there are some serious risks involved. Many women have psychological trauma because they are not properly prepared nor emotionally ready to have an abortion procedure. Abortion is a topic of great emotional distress for many, and there are both moral and ethical issues brought up by both the advocates and proponents. Clearly, using one or another of the many valuable methods for contraception discussed above is better for all concerned and avoids the risk of undesirable pregnancy with the need for an abortion as an ultimate solution. Which contraceptive method works the best? Statistics for contraception methods suggest that Norplant has the best overall rate of protection for those methods which can be considered reversible. There are generally no more than 9 in every 10,000 women who will become pregnant using Norplant. Following behind this is vasectomy, male sterilization, next female sterilization by hysterectomy, then sterilization by tubal ligation, followed by oral contraceptives. Oral contraception or birth control pills follow tubal ligation as the next most valuable method. Of the combination estrogen-progesterone and progesterone pills that are often used, progesterone-only pills tend to lead the combined estrogen and progesterone products for effective use. Below these methods are male and female condoms, cervical caps, diaphragms, spermicidals, and withdrawal. Contraceptive methods with the lowest value, and in some cases no value at all, are the natural methods, with abstinence appearing to be the least most valuable method for trying to prevent pregnancy. Why choose one method over another? Most women will use several methods of contraception during their fertile years. The method they use at any one time will likely be based on 1. Their need to protect themselves against becoming pregnant, 2. Their past experience, good and or bad, with other methods of contraception, 3. With whatever is available to them at the time they are looking for contraception. In addition to these, there are several other reasons. Number 4 would be what they can and cannot afford. Number 5 would be personal beliefs and preferences about contraception, pregnancy, abortion, and sex. 6 would be personal comfort and desires. 7 would be a desire for temporary or permanent protection, and 8 would be theirs and their partner's needs and beliefs that affect which methods they're going to be able to use successfully. If you have questions about what is the very best method of contraception for you, then we suggest that you watch programs 1 through 3 again, in addition to information and answers which can be found out at our website, which we will give the address of at the end of this presentation. And certainly you can ask your doctor for what information is available to you about your specific needs. We wish you a happy family planning and the best and healthiest of families that you can have. We'd like to thank you for watching Contraception Pregnancy Prevention Program Number 3, Birth Control Methods, Prescription Contraceptives. This has been a presentation of Health Education Associates, Palm Springs, California. For more information about contraception, its uses, benefits, and risks, please go to our website at http://www.holisticgynps.com/contraception. This production was written and narrated by Dr. Alan Lawrence. It was edited by Dr. Lisa Robin Lawrence, Ph.D., and it was produced and directed by Alan Lawrence, M.D., and Lisa Robin Lawrence, Ph.D. Thank you again. Have a wonderful day.